Welcome to Let's Talk Value podcast series. And today I'm happy to welcome Rado Andrian to the podium. Hi, Rado.
Hey, hi, Verena. How are you? Very happy to be
Thank
here
you.
with you.
Absolutely. And I'm particularly excited to talk about a topic that is not my core expertise, which is digitalization, maybe even AI. I don't know what we will talk about, but quick, before we dive into the subject matter, quick reminder, my name is Raina Walter. I'm the CEO and founder of 5P Healthcare Solutions, a small boutique healthcare consulting firm, which is doing big projects, small and big. But for the interested reader and listener, feel free to look us up. And I'm also the author of It Takes Five to Tango, From Competition to Cooperation in Healthcare. And I know that cooperation will be a theme here today as much as the famous buzzword patient centricity and what does that mean. But without further ado, really, Rado is one of the few or many, depending on how you look at it, digital health strategy experts. And I say many because, of course, it's a little bit, we're riding a wave. Many say maybe even a bubble of digital health. But I'm particularly interested to learn more from Rado today around using it as a means to an end rather than digital being a means on itself. And we'll explore what that means. But maybe, I don't know if you want to briefly introduce yourself, and then otherwise we can just kickstart with my lead question always, what does value mean for you in healthcare? But take it away,
Sure.
Rado.
Yeah, sure. Thanks, Verena. And hello, everyone. Yeah, so my name is Rado Andrian. Basically, to your point, I've been living digital health my entire career. It wasn't always called like that, but this is what it is. I started with medical imaging, which was really what started the whole thing. And I was lucky enough to really evolve with the technology, really going from, medical imaging, PAC system, hospital information system, and then just following the evolution of technology with the consumerization and commoditization of those technologies. Adapted to healthcare. And what you just said is quite relevant, actually. It's a mean and not an end. And I especially focus on innovation, digital innovation for the healthcare systems. And I was lucky as well that I worked in medtech, clinical research, trials, pharma, startups, and consultancy. So I hope I can provide a bit more insight on this digital space for healthcare.
Great, and thank you for reminding us a little bit the recent historic lifespan of digital health and where many of it started in terms of the imaging part. I also like what you said, the digital innovation part, and then you also did mention systems. So let's maybe start with the innovation part and more from an individual user perspective. And as our theme here is value and patient centricity, how would you describe what's possible today already in terms of digital helping with value generation at the really point of care, which is the patient, and how does that derive value directly to a patient? Any ideas, examples?
Yeah, well, I think, well, just to state a bit my conviction, digital innovation and technology innovation, as we said, it's not a name on its own right. It's really a mean. And I like that sentence we say, just the best innovation is invisible. And I think in healthcare, it makes really sense because you want to bring innovation that allows people to do their job better. If you're a nurse, it doesn't replace the nurse. It really helps her. I mean, it redefines the job, probably most likely, but it elevates her capabilities, and the doctor and the whole health ecosystems, all the players in the health ecosystem can benefit from digital. And that's where we should really focus our innovation, because we are providing tools to help improve healthcare. I mean, we see all the trends today. Well, more and more people live with chronic conditions. Cost of healthcare are increasing. something needs to change. There must be a radical change, but at the same time, and that's where it's a bit paradoxical. We're talking of radical change in a system that cannot be flipped from head to toe like this straight away. So digital plays a role as a lattice, and data. I mean, when I say digital, it's digital data and platforms, and all the technology, all these commoditized technologies that are really the core of our daily life. But they are a lattice for the new ways of considering health, and it's been for a long time, and even still today, very centered on, okay, you're sick, I need to alleviate your symptoms, I need to give you a medication, I need to give you a treatment, to, well, let's consider for a second who you are and what you're going through. And when we talk about chronic conditions, it's not just one disease. Most people develop over time a plethora of little things, and then one pops up as, okay, this is your main disease, but you have lots of comorbidities. We talk about diabetes and obesity, we talk about fatigue, we talk about sleeplessness. You need to consider this as a whole, and again, where digital innovation plays a central role as a lattice is, we can, for once now, capture so much of those insights. And that's what's been my driver all along my career, which was digital has this value that you can capture objective measures and insights, not just in one specific condition, but a plethora of subsystems in the body or surrounding as well.
Yeah, and you did mention the keyword data, because obviously digital, again, is sometimes too abbreviated and too shortened in our quick speaking and texting and whatnot in terms of social media messaging and so forth. But the longer version really should be, it's about the data, electronic data capture by patients, by hospitals, by systems. And obviously the digital can not only organize the data and structure it, but also it's instant, right? There's no delay technically. So if we stay for a moment on the individual level and the users, I like that you already started broadening the users towards the 5P, like patient, you mentioned the providers like nurses and physicians and doctors, who really, it helps all of them do their job better. And there's a lot already that's existing now today in many countries and many regions. What is the latest that you're excited about in terms of innovation for the future to bring us to the next level from an individual healthcare user perspective?
Well, before I answer that, I mean, you talked about value, and I'd really like to anchor everything on value, because this is central to everything we do. All the stakeholders, your 5Ps, they have a value that they're seeking. And if you take the patient perspective, I'd say that's where you have most of the value drivers. We often talk about outcomes, clinical outcomes. That's a traditional model, and it's still very relevant today, because I think most of the time it's still overlooked, because we pay for service and not pay for outcome in many ways. But it's not the only one. Access is a major value for patients. Awareness is a major value for patients. Quality of life overall. And there is an additional one that is emerging, and it's health and wealth. And this is where you have now even the payers, the insurance companies, they are interested in digital health because of that. It's really not just like, okay, how can we reduce the cost and the claims, but it's really just like how, and that ties to social determinants of health. Just how do we sustain someone and not get bankrupted because there is a certain intervention that they need to leave. So there are lots of values, and where digital can play a central role is just really highlighting those different value drivers in the solution that we are building. So we need to exacerbate, and that's where, when we talk about patient centricity, just like, yes, you want delightful applications, but before that, just like, do I create a solution that touch on accessibility, that gives awareness? Because we all talk about, yeah, patient is the CEO of his health, but you cannot make decisions if you don't know what you talk about, or you don't know what the doctor tells you about. So these are key elements that digital solutions that we bring to market really need to address all these different components of value, and they are not just on the patient, they are shared with all the stakeholders at different levels. Sometimes they are a bit antagonist, but that's where we need to take on the opportunity. And for me, that's what's most exciting, basically, to answer your question. It's really that digital solutions today can really exacerbate those different value drivers, and then we can act upon them.
Do you have any concrete examples of projects, or because also there's the whole sensor technology and wearables, to measure data at the point of care at the patient directly and like feed them back into the loop towards the other users, the doctors, the nurses. You mentioned social determinants of health, social workers, caregivers.
Yes.
So do you have any like practical examples for us to picture this? I don't know, is it
yes, I'm working now with a startup that helps the elderly live more independently and safely at home. So it's a solution basically that is a bit of the Alexa of health, and it's not just meant for the person to use it at home. It connects the ecosystem. So, the person is old, and the system understands that he has mobility problems. You have sensors around it to help him really, in case you have risk of falls, you can contact directly the caregivers around. Or if you work with here in Switzerland, we've got the Spitex. It's just like, okay, I need someone. I need to send a nurse to just like check out on the patient. It helps also the doctor, because you measure just the different parameters on that person living on their own. It also helps really develop a care program with the patient, and then we have an AI system there that just really supports that person, change the habits. If that person is old, has diabetes and other conditions, just like, okay, how can I help you with your nutrition? How can I help you to sleep better? And this is fed back to the care team, but this is fed also to the whole ecosystem, because obviously if you're not as sick, insurance companies can say like, okay, I can see the value of that solution. I know that, whatever your premium is today, just like, yeah, you're getting better. So that's one typical example of, yes, you have a digital hub in your home, and it's really meant for that person, but it has impact on all the care management around him.
So it's that's this link to the collaboration and cooperation piece that we mentioned in the introduction.
Yeah.
And it's really that glue that enables better communication. And I also want to just remind and repeat what you said early on, that digital / maybe even AI, you started introducing that concept, is not replacing current people and roles. It will not take away the doctor, it will not take away the nurse. It is meant to help people do their job better and maybe more efficient, and carve out the nuisance of administrative and bureaucratic paperwork, to just spell it out here, because we know that's what our listeners, some of them are really from the physician and hospital caregiver world, and they, are really suffering from too much administrative bureaucracy, and some of this can alleviate.
Yeah, I mean, it will definitely change the roles. I mean, if you think about radiology, I mean, the imaging is my background. If you think about radiology, I mean, before, the surgeon had to open your body to see what's inside, and then imaging came in, and just like, oh, I don't need to open that much the body anymore. The role of radiologists really evolved, and the role of the specialist around evolved as well. So yes, there is an impact. Your job will change, but it's, you will not remove that person, because we're talking about health. We're not talking about a consumable product. We're just like, yeah, okay, I'm going shopping, and I just like put my product through a code bar, I don't need someone. We're talking about health. There is one element, which is empathy, that is concern, and that is listening. And yes, we're developing AI that are more empathetical, that learn to listen more and give that feedback. But at the end of the day, when you need someone to be there, how do you do that? You cannot replace. And the role of the nurse will be modified because, and you mentioned it, there is this administrative burden. There are not enough nurses. And when you are an organization where just like, okay, I have 4 nurses and I have 20 patients, they get the insight before they go to see the patient. They know that they've taken the medication, then they can just spend more time with that patient. That's the quality of life element that we're talking about. So yes, the job is changing a bit, but the job
to the better, listening to you.
For the better, yes.
I'm getting excited again, about my own initial job, being at the patient's bedside. But I think we cannot emphasize this enough. Obviously for the lay public that doesn't know much about the healthcare professional expertise, etc. But even for healthcare professionals, we hear often the anxiety and the fear of the newness. I have sometimes asked my own care doctors that I still see write with pen and paper. And I don't have always courage to ask, why are you still using pen and paper? And why don't you move to digital? And you know what? Some of them that are maybe from the boomer generation, they say, Verena, I just fear writing on the keyboard. I am just so much faster with my pen and paper. I've done it for 30 years. So I think that fear factor, it's just very human. It's such a new spectrum in the, fifth, sixth industrial revolution? I don't know, I stopped counting. But so thank you for reminding us it is not replacing people. I like really how you rephrased that and said it's changing, it's evolving, and maybe to the better, who knows? But I like the way you position it and you bring the perspective. Yeah,
but to your point with the doctors, I mean, yes, there is that scare factor. Will it replace my job, or am I becoming too slow? How do I integrate those technology? And that's where, as I said, technology is not an innovation per se, but there is the innovation part of it. And AI, if I take the doctor, they have more and more patients because there are less of them. And in 15 minutes, they need to review everything. So the doctor says, yeah, I still have my notes. Why? Because if I put myself in front of the computer screen, I got distracted by so many emails, so many things. So forget about it. That's why now you've got this business with Remarkable. Just take your notes without this disruption. Beyond that, if people understand that, yes, you have more information coming in, but that information is filtered, because that, and I can see that again, I'll always come back to imaging. Imaging, brought lots of innovation in terms of, you see more, you see better. But for the radiologist, suddenly, instead of looking at one slide, they look at 3,000 images and just like, I still have 15 minutes only to look at everything. So that's where there was space for technological innovation to say, yes, okay, we allow you to still ingurgitate all that information in a way that makes sense to you. And today we're talking about EMR, and where people, we need to change that fear to an opportunity, which is, okay, you have an AI, you have a patient that comes in, it's a new patient, and it's just like, how do I review 15 years of historical data? Well, AI today can summarize and synthesize and just like give you, okay, look, he's coming for this, that's the first 5 priority elements that you have, and then you can really manage that information. And this is where there is an area of opportunity. So again, it's not going to replace the final decision from the doctor, but it can really help him. And that's where just like, okay, maybe there is an element of fear that we can remove because we're bringing something, and that's on the productivity. And, okay, AI is doing diagnostic, but it still needs to be confirmed, and AI is missing things as well. So yeah, we're at that in-between stage. but I think what's important is really to state that it's here to help, it's here to optimize, and it's here to alleviate some of the pressure that healthcare providers have. We live in an economic system. When people say I only have 15 minutes, most of the time it's not because they don't want to spend more time, but because this is what the system is built upon. So if technology can really help give back that time where there is more care, then that's where the first step to transform the fear to opportunity should really stand.
This is such a wonderful almost conclusion already. And I know there's always this like 20-minute mark of our conversation, and it's there faster than you think. But is there anything that you haven't mentioned that really in your like thinking of this podcast coming up, you wanted to make sure you really get along here? So any last concluding comments you want to make, Rado?
Yeah, I mean, my tagline that you can see on my LinkedIn is it's co-creating innovation. You mentioned collaboration, and I think it's central. And digital is a vector. As I said, it's a lattice. We live on silo. We've been living on silos, and obviously there are the cybersecurity and all these aspects, but the primary function of really a lattice is just to streamline and really make accessible. So yes, we need to find ways to protect. That's where another area of technical innovation. But as a mean to an end, it really enforces collaboration between stakeholders. And I think that's where we have an opportunity now. We need to look at it as now we can, through technology, see more and see more perspective. That's from the patient, but from all the actors around the healthcare system as well. So collaboration is very, very central.
Music to my ears, and I guess to the listeners' ears. Thank you very much, Rado, Andrian.
Thank you.
All the best.
Thank you.